COU Family TV. That's on Twitter, X formerly Twitter, Facebook, Instagram. We are also on LinkedIn and YouTube, where you can watch these shows live as we bring them to you. We also do have our sponsors, that's Protea Hotel by Marriott Entebbe, that promise comfort and luxury at its best. With me in studio is Dr. Nandawula Kevin Nabukera, who is a medical officer and general practitioner, and of course the discussion is going to be sensitizing you, our colleagues or our viewer, about HIV and AIDS, the treatment, the challenges, and what the victims go through, and how to prevent yourself from getting HIV and AIDS. You are most welcome to studio, Dr. Kevin.
Thank you for having me.
Yes, it is a great pleasure to have you. You can say hi to our viewers as we start, and maybe wish them a lovely World AIDS Day.
Hello viewers, I'm Dr. Nandawula Kevin Nabukera, and I'm here to inform you more about HIV, and thank you for participating in the World Health AIDS Day yesterday, and yeah, we are glad to have you.
Okay, as a doctor, you have seen or interfaced with people who have the disease, and one of the things that I know about a person who has gotten HIV is they lose self-esteem. Has this been the case? Is that true? And how have you handled them to make sure that you give them hope and tell them it's not over?
Yes, it's very true that people, when they're diagnosed with HIV, of course there is panic, just like any other chronic illnesses, like cancers. People are terrified. Initially, most people are in denial because they know that the disease is not going anywhere, and they're going to have it for the rest of their lives, and it might be debilitating, so it worries them. But usually, when someone is going through HIV testing, there is pre-counseling. There are people to talk to you about the disease, to help you, to guide you like on where to seek health care in case you're diagnosed positive. Okay. And there's also post-HIV testing counseling, where of course, like before you go through it, the testing, you're worried, so there is counseling to help you overcome the worry. But then also after you've been tested positive, there is counseling to help you find out where to seek care, to help you find out which communities and societies, groups of people, to help you go through that disease.
Okay, thank you so much. When we look at the statistics, do you agree with the Ministry of Health that actually the numbers of people getting affected or infected by HIV is actually going up by the day?
Yes, especially based on 2023 statistics. Uganda, out of all the sub-Saharan Africa like countries that had HIV, had the highest rate of infection. Okay. So yes, I do agree with them, but surprisingly these statistics are more towards, like, women are more affected as compared to men. For example, in 2023 we had 1.4 million people who had HIV, and of those 1.4 million people, about 860,000 were only women. So that is very alarming, and I do agree with that.
Okay, and how best do you think, as a country, as a community, as a society, we can drop these numbers? Because among the people who would want to see the change of by 2030 ending AIDS is you and me. So how can we make sure that these numbers actually go down? So
we can ensure that these numbers go down by empowering women.
Okay.
Of course, like to take charge of preventing themselves from getting HIV. And there is a lot of material, there is a lot of help that can be provided to you to help you prevent yourself from getting HIV. For example, we have different ways of preventing getting HIV. For example, we have behavior changes where you can abstain. For example, girl children, you can prolong the period at which you start having sex. You can protect yourself by having female condoms. They're available, because sometimes men will tell you, oh, I forgot, oh, this and this and this. So you can help yourself by having male condoms and female condoms in your own home. And then we can encourage men also to help their own women by undergoing safe male circumcision. Okay. At hospitals. And also we can do biomedical prevention, where we can have using of drugs like PrEP and PEP, and there are different combinations. Like PEP is pre-exposure prophylaxis. So before you go, if you know that you're at high risk, for example, people who really enjoy indulging in sex, you can take the PEP before going for those said sexual activities. And if you know that maybe you're a discordant couple, there are people that are living with partners that have HIV, but they themselves are immune to getting HIV. But that immunity, like, you can also protect yourself. If you're really in love with this person and they're on treatment, you can take the PEP. Then there is also PrEP. Sorry, PrEP. I was talking about
PrEP. Is
you
before.
take it before, so it is pre.
Okay.
So that you take the PrEP. Sorry, but then there is also PEP. When you're taking PEP, these are for people who have already been exposed. Like, for example, people who have been involved in sexual assault. You've been raped. You've been defiled as a child, and you don't know whether this person has HIV or they do not have. And also people who have been involved in a mass road traffic accident, because other people are bleeding. You yourselves, you have injuries, and you don't know their serostatus. So it is better for you to go to hospital and check your, like, they first test you to confirm that you don't have the HIV, then they'll start you on treatment to help you prevent yourself from getting HIV. And there are different combinations of this. You can opt to take a pill, you can opt to take injectables, and also for PrEP, there is a vaginal ring for women who prefer, like, to be discreet about their treatment. You can use the vaginal ring to prevent yourself from getting HIV. Okay,
since this is an empowerment program to make sure that women are safe, the vaginal ring is said to protect you from getting HIV and AIDS at any time. So you put it while you're going to have intercourse. That's
it will protect you if you put it 24 hours before. So you don't just put and then you go and indulge in sex. You have to give yourself time, the 24 hours to elapse. Then you can go on and use it,
and you will not get infected.
So it will protect you up to 28 days. Then you have to switch and put in another ring.
So you have the ring for 24 hours and then you remove it?
No, you keep it in for 28 days. Wow. So, but it will start being active, or the drug will start being activated 24 hours after you have put it in, is when you're now safe to maybe start indulging in sexual activities. Okay,
and then you talked about partners who are immune to getting HIV and AIDS. What do you mean by when you say immune?
Yes, we have discordant couples. There are people who have partners that have HIV, and ideally we would think that these people are also prone to getting HIV, right? Yeah. Because most times when you have intercourse with someone else that has HIV, you will get HIV. Okay. But there are people that will not get HIV despite them being with partners that have HIV. So we, so in the body we have certain things that protect you, like for example, for the virus to be able to get into one's body or the cells of the body, it has to bind to certain receptors and also co-receptors. Okay. So usually these people that do not get the HIV, they have mutations in those co-receptors. So for the virus to enter, it has to bind both the receptor and the co-receptor. But now for people who have a mutation in that co-receptor, the virus will not be able to recognize the receptor, or it will fail to bind onto that receptor, so they will not get HIV. Or sometimes those people have a low level of that co-receptor in their body, so it is very difficult for the virus to keep on binding and entering new cells. Okay.
And how do I know then that I'm immune?
You may not know really, but if you go to hospital and test, if your partner is tested positive, of course most times if you're married to that person, you would be invited to also be tested. Okay. Or most times you're going to be tested together, and you do know that you've been having sexual intercourse with this person, but somehow you do not have HIV. So that is what we call discordant couples. And usually there is advice on how to go about it.
Okay. As a person who is practicing, especially medicine, how best would you encourage somebody not to believe, we talked about the lies where someone can tell you, no, it's already late, but there's this particular lies where they say, no, I'm not sick, I'm well, can't you see, do you see me as infected? How best can you tell a viewer that it is not the body, it is not how the body looks that is sick, but rather you have to test before? Because these young people these days, they just go in without even testing. They just go in and into the acts of sexual intercourse and all without checking. And I'd like you to just make a caution for the people out there.
So yes, unfortunately, a lot of people have that belief that if someone looks a certain way, they cannot have HIV, which is very unfortunate, because most time, like nowadays, people who are on treatment will not have the typical features that they used to have those days of wasting. Someone completely looking very malnourished, you can see their bones. So it doesn't necessarily mean that if someone is looking a certain way, they don't have HIV. And also you cannot tell that someone has HIV by just looking at them. You have to test the blood, because HIV multiplies within body fluids. So you cannot just look at someone and say, oh, she doesn't have HIV. And also it would be very precautionary for you to test that person or to test yourselves if you have not tested in the past 3 months. So whether it is your partner or it is yourself, you have to get tested at least every 3 months.
Okay, thank you very much. Talking about testing, we do have the signs of HIV and AIDS. What are those signs? Can you point out a few of those signs?
So signs will depend, but of course initially you have flu-like syndrome, because HIV is a virus, and when it attacks cells, like any other virus, you'll have flu-like symptoms. Like you'll have fever, you'll feel weak, you will, feel like chill. So those are the flu-like symptoms. But initially, since they are self-limiting, like any other virus infection, when you get a flu, you don't necessarily have to treat it for it to go away. The symptoms will go on their own. But that doesn't mean that the disease has left your body. No, it just means that your body was trying to fight and mount an immune response, and now it is still fighting. It has tried to overcome the disease, but later on, as disease progresses, you will now start to get maybe your lymph nodes will swell, like someone will have a swellings, multiple swellings on the neck and other lymph nodes, because we have several lymph nodes in the body. They might have oral candida. And they may also have something we'll call oral hairy leukoplakia, where you have hairy particles on your tongue, in the mouth, and in other areas of the mouth. So there are a lot of things to look about. And also, when you do not treat, then disease will progress. And so the symptoms will increase from what you started with as a flu-like syndrome to the next syndrome where you have lymphadenopathy and all other things. And then, if you continue not treating yourself, then you will end up with an AIDS syndrome. Okay. So when you have AIDS, you then have other issues like tuberculosis, cryptococcal. You'll end up having cancers, because the disease, as it progresses, it manifests with different signs and symptoms depending on the stage of disease. Okay,
talking about the progression of the disease, how long does it take to see or to detect HIV? For example, if you got it this week, how long would it take the doctors to catch it in your blood?
Usually there is a term we call seroconversion. Okay. So seroconversion, as the disease keeps on multiplying, by the time we say that you're seroconverted, that means we can recognize the antibodies and the antigen. The antigen is the virus, and the antibodies your body has produced to fight against that virus. We can now see them in your blood. So that will take about 14 days. That is why most times when you have inconclusive results, when you go to test yourself for HIV, they'll advise you to come back after 14 days. Because then we expect to see the virus and the antibodies in the blood.
Okay, and is there any difference between HIV HIV and AIDS as AIDS?
Yes.
If any, then please elaborate.
Yes, there
on
is
that.
a difference because initially you start with HIV. You have a virus that enters your body, and then it mounts an immune response and continues multiplying. When you don't treat this disease, because this virus affects white blood cells in the body, it will break them down. So your body, remember, white blood cells help us to fight disease. So the more it enters your white blood cells, it infects them, and other cells recognize those cells as infected or as foreign. They attack those cells.
Okay.
So your body starts to attack those cells, but since the more they attack, the more the virus spreads. At the end of the day, you end up having fewer white blood cells. So what we call AIDS is when those white blood cells that are supposed to fight disease are very few that are left in the body. So you usually have on the blood, or when they're collecting your blood to see the amount of cells you have, usually have less than 200 cells, which is really bad. So that is what we call AIDS, an acquired immunodeficiency syndrome. So you have, your immunity is very low because your white blood cells are low.
Okay.
But it's acquired because your body did not, because you didn't have it initially, but the virus caused you to acquire that immunodeficiency. Okay. I don't know if I've made things
yes,
better or
you
worse.
have made sense. It is better. And let's move on to sex education. We have curriculums in school and school programs. As a medical practitioner, do you think that sex education should be one of those things that actually are taught in school? Things that are told to students or pupils as young as possible, so that they get it in their mind, because most of these teachers are shy. They don't want to talk about that to the children or to the students, and what we are seeing is that these students get the information from other sources that wouldn't or might not be very, very good or favorable for their young minds.
Yes, I do believe that. As someone who went through sexual education with my parents at home, of course, like, your parents will be shy to talk about these things, but if they don't empower you that way, even parents should do that for their children. Schools should also do that, because a lot of Ugandan children spend a lot of time in schools as compared to home, because they're in boarding school.
Yes.
So I do believe that, yes, we should empower these children, but we should find ways of giving this information that is appropriate for age. So for example, young children, like children in primary school, you can empower them by telling them that their private parts, like, you teach them about private parts and who should not touch those private parts, where they should seek help in case they encounter such trauma or someone touches them where they do not want to be touched. They should be vocal about whatever is going on. So then maybe secondary school, because children are going through all sorts of hormones. People want to have boyfriends, people want to have girlfriends, they're sneaking around. So maybe we can talk to them about condom use, about how to prevent pregnancies, how to have safe sex, and also what to look out for, because also other sexually transmitted infections can predispose you to have HIV, because now talk about syphilis, where it will give you a wound. That wound will be an inlet also for viral infection, for HIV infection. So yes, we do have to talk about these things. And also, maybe if you do think that the child, like, you don't want to talk about these things forward, maybe as people join university, because that's when most people, like, want to wild out and become crazy and, you know, explore. So maybe that would be a more appropriate age to now talk about empowering your child, like, seek PrEP, use condoms. Is your partner circumcised? Are the people you're having sex with circumcised? Could you stick to one person? So yes, I do think it would be very important to have sexual education that is appropriate for age.
You mentioned that STDs can lead to HIV and AIDS. Please elaborate on that.
So we have STDs, like, maybe, you know, like syphilis. In the initial stages, someone will have a wound, like sometimes most people don't see these things because most of us shy away from looking at our partners or that we're having sex with to check out for whatever they might be having. Some people might have a rash, some people might have herpes, and all these things at the end of the day usually turn into wounds. And we know that for you to have an open wound is a high risk of you acquiring HIV, especially if you're in contact with bodily fluids.
Okay, and how about treatment of HIV and AIDS? We have been told that you have to have a balanced diet once you're already sick, but first things first, we are still at the point where HIV and AIDS has no treatment, right? So
it does have treatment, it doesn't have
no cure. Okay, and shed a light on the treatment process and how exactly somebody is supposed to go by the rules to make sure maybe they sustain their lives a little bit longer. Yes, there is no cure. Although some Christians believe that it can be cured, there is no cure, but the treatment process.
Yeah, so before you start treatment, of course you have to be tested, and then you have to be counseled about taking your drug daily, like about you being on it, because when you reach a moment and give up, which is highly likely that most people, if you're taking a drug every day for the rest of your life, it becomes cumbersome. So some people usually give up halfway and quit taking, and then when the infection mounts, they now go back. But usually you're cancelled, you're tested, because when they initially test you, wherever they've tested you from, you'll have before they start you on treatment, they will retest you again. And of course they have to retest you for other infections, because like I said, unfortunately most Ugandans will seek health care for HIV when they're in chronic stages, or when they have another co-infection, like let me say TB or cryptococcal, they've lost consciousness and someone else has brought them to hospital, so the doctors are trying to look out for what has caused that disease. So, and initially they have to test you for those other conditions, because they cannot start treatment without treating you for those conditions for at least 2 weeks, because that will cause there is something we call SARS, so it will cause that. But initially when you're tested, you're retested, and then you start treatment, depending on whether you have other co-infections or you don't have them. So we have different lines of treatment, where we have first line treatment for any and everyone that has been diagnosed for HIV for the first time. You will start on the first line treatment. Now when you get failure of first line treatment, for example, your viral load, the HIV virus is still high in your body as compared, you're on treatment, you're following it faithfully, but the virus is not decreasing. You will then now be switched to second line drugs. So if that fails also, you will then now be switched to third line drugs. So that is the order of which we follow. And also children and adults are treated differently. So there are different regimens to treat for different age groups.
Okay, thank you very much. And what is your view or take on projects like maybe Straight Talk and reproductive health that come out to encourage the youth especially to stay away from some of the things that might lead them to down the path of acquiring HIV? Do you think actually they are doing a great job?
Yes, I do. I do think that anyone who is empowering women health, like reproductive health, is on the right path, because when we talk about transmission of HIV, we also have vertical transmission, where mothers can transmit the disease to their children.
Babies, yes.
So, and in order for you to talk about, you cannot talk about reproductive health without talking about that. So, and I do think that that is very empowering to help people know how to breastfeed their children, how to seek for testing for their infants, how to prevent their infants from getting HIV despite them having, because we have things like syrups that they give the babies immediately when they are born, usually give within 72 hours. So even if you give birth from home, you can go to the hospital and get that syrup for your baby within the first 3 days of life. You make sure you don't exceed 3 days. So however busy you are, fix time between the time of giving birth up to 72 hours, and you go and get that syrup to help your baby, because even if you're breastfeeding the baby, it will protect the child somehow. Of course, we do testing for those infants up to 18 months to make sure that they are not getting the infection.
Okay, thank you. Now, just before we go for a short break, talking about the 3 days, within how long is somebody supposed to take the PEP that you talked about, and how exactly does it affect? We've had stories that it gives you nightmares, serious nightmares. So just shed a light on that.
Yes, you have to take the PEP also within 72 hours. So in case you get a needle prick, or you've been raped, or as you're consoling yourself from the traumatic event that has happened, please go and seek for help to get PEP. And yes, it does have enormous side effects. You really do have symptoms, like you really suffer through it, because even as medical professionals, we have friends that have been pricked with needles, so, and they have received that PEP, and they do get the terrible symptoms. But you are thinking that as you're taking the treatment, it is just for 28 days and I'm protecting myself for the rest of my life. So it should not deter you from taking the medication because you're feeling so bad and the side effects are bad. It should just encourage you and motivate you to know that it is just 28 days and I don't have to have HIV for the rest of my life. I think that is a good outcome. Right?
It is. Thank you very much. Now we are going to take a very short break. Issues at Hand is still ongoing. Remember to follow the conversation on our X, formerly Twitter, that's at COE Family TV, and also we're on YouTube where we are live, that's at COU Family TV. We will be back. Don't go away.
Issues at Hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
Welcome back to Issues at Hand. We're glad you're still watching Church of Uganda Family TV. My name is Karen Wamani, bringing you the show. Now remember, yesterday was the World AIDS Day celebration, and in Uganda it happened in Buyende district. Now we saw dignitaries of different stature down there in Buyende, including retired Major General Jessica Alupo, who is the Vice President of Uganda, as well as the Head of State, Yoweri Kaguta Museveni, who officiated. Now one of the things he said was that he hopes that the availability of HIV and AIDS drugs does not be a consolation to living a risky life, especially to the young people, that if we have drugs, it does not mean that now we should just live recklessly because we can treat and live on treatment. He also said that currently 1.4 million Ugandans are infected with this disease, so you never know the status of your neighbor or the person you're in love with until you go and test, just like as our guest has told us. Her name is Dr. Kevin, and she is a medical practitioner. She is taking us through the discussion. Now, there are initiatives made by government that help to sensitize people, just like we're doing now. But do you think that the government needs to do anything more to further sensitize communities? Because look, these days we are on in a digital era. However, we have people in the villages who do not have access to the phones and the TVs and social media. How best can government come up with different programs to guide in the... I know this is not your field because you're more into the medical, but you can give a word or two about how best government can reach out to those people that do not have access to social media.
Yeah, I do think that the government has done quite a very good job.
Yes, it has.
Because a lot of people currently are very informed about HIV, where to seek help from, and according to the encounters we've had in hospital, even people that are coming from remote areas, even islands, because while I was working in Entebbe, there were people who were treating from islands, and yeah, we expect that demographic of people, most of them don't have smartphones, they don't have TVs, they don't have iPads, so but those people were informed. So I do think that the government is really trying, though maybe they could bring back, you know, when we were in primary school, we had initiatives to prevent AIDS, and we used to talk about those things during drama, during MDD, during classes. So maybe that could be another, they could put in more effort to bring that back, because it was quite empowering. Yeah, and for the fact that I can remember it up to now, it affected, it had an positively effect. So maybe that could be good to bring back. Okay. Yeah, but I do think that for the vast majority of the population, people are informed. Though also, like as the president said and was cautioning people to not indulge in having, you know, unsafe sex because they know that drugs are there. Unfortunately, we've heard a lot about that when we are at hospitals. People do tend to not care, like they are no longer scared of having HIV as they are scared of having pregnancies, which is sad because people will quite frankly tell you that I would like the pregnancy will show, but the HIV will not show. So, and there are drugs that I can take to help myself as I have HIV, but the pregnancy is forever. It will have consequences. So sadly, people try so hard to prevent themselves from getting pregnancies as compared to preventing themselves from getting HIV. Yeah, so.
Okay. Thank you very much. And we go back to the discussion on mothers that are infected. At what point can a mother or a pregnant lady be tested to detect HIV?
So usually people attend antenatal. Sadly, they attend late. Most people come when they're about 4 months into the pregnancy, but usually it's advised for you to, the moment you find out that you're pregnant, you start attending antenatal. So usually HIV testing is done at the antenatal clinic for all mothers that are pregnant. According to the government guidelines, the Ministry of Health guidelines, you have to get tested for HIV. Of course, they are cancelled, and then you get tested for HIV. So that's the first encounter for getting tested for HIV. And usually, consequent visits every after 3 months, you can be tested. But some people skip going for antenatal. So usually, the next catchment area is before they give birth, or immediately after giving birth, people are tested. And then when you come for your postpartum, after you've given birth, when you come back at 6 weeks, you also get tested. So also, if at this point in time you were tested positive, you are breastfeeding your child, and your child is already on the syrup, the child will also get tested, but they don't do the usual test. Usually for children we do a PCR instead of the rapid test. So you and your child will both get tested at that encounter.
Okay, and how about breastfeeding these young babies in case a mother is infected already and they've given birth successfully to a person or to a child that is not infected? How do they then go about breastfeeding?
Of course, there is usually risk because at the time of giving birth, there is bleeding, there is a lot of blood, there is a lot of contact with body fluids between the mother and the child. So that is why we give the syrup. And usually, if the mother has a low viral load, we encourage breastfeeding. But if they can't afford to have formula milk for their baby, it is also highly advisable. However, we do not advise you to mix the two. So if you are choosing breastfeeding, you breastfeed your child throughout. It is very safe as long as the child is on the syrup and your viral load is low. Usually there are very little chances of your child acquiring the HIV from you. And so we encourage it, but we don't otherwise recommend mixing. So if you are prepared to buy baby formula, please do baby formula until you reach 6 months, until your child is 6 months. Then you can switch to normal feeds. But if you're choosing breastfeeding, please do breastfeed up to 6 months and then start other feeds.
Now, baby formula is said to be not so good for babies, and they usually don't grow up to be normal children. You agree with that, or tell us more about that?
Yeah, baby formula, it of course doesn't have when you're pregnant, you get vaccinated. You yourself throughout your entire lifetime have been vaccinated. You've had encounters with diseases and your body has fought against them, which ideally it has released antibodies for those said diseases. So why we encourage breastfeeding is because also as you're breastfeeding your child, they are getting those antibodies from you who has already fought disease. So it will ideally reduce levels of your child getting infections below the age of 6 months. So, but that doesn't mean that formula milk is bad. It just doesn't have certain, say, nutritional benefits, antibody benefits as compared to the breast milk. So ideally breast milk is very good, but also you have to weigh the benefit versus the risk. So in your mind, if you're already telling yourself that I don't want to expose my child at all or risk it, then baby formula is good. It is way better than cow milk or other forms of animal milk because it has been graded for the neonate or the infant.
Okay.
It is not bad. It is not what is formula milk.
Thank you. And how little are the chances of a baby, because you said there are very little chances of them acquiring the virus, but how little are those chances? Do you have cases where actually the mother does everything by the book, as you've said, and then the child still gets infected?
Actually, these days the chances of children getting HIV are very minimal. As if they are like after giving birth, of course, like I said, we are giving the child this syrup. It is called a nevirapine syrup. It is an antiretroviral drug. Okay. So it is helping the child in case they had residual virus little minimum amounts of virus entering their bloodstream, it's already there within the first 72 hours to fight off the virus. So we have very few chances of people most of the people that I do know or that I encountered whose babies had HIV below 6 months did not take the syrup, had home deliveries, so they increased their chances, and most of them are in denial that their child actually has HIV or that they themselves had HIV, because sometimes when you know that you've kept yourself safe, it is very hard to overcome the betrayal that your partner gave you HIV. Or some people do know that they have HIV but are hiding it from their partners. So we encounter such people day in, day out, like on some occasions, and of course we give them counseling, but some of them really are in denial, or they don't want to believe that, oh my god, I gave my child HIV. So they are blaming themselves, which is also sad, but there is nothing to do about it. Usually it is from home deliveries because they were unsafe, like there was no safety net given during that delivery process. We don't know what they went through, and they did not seek health care for themselves and their child after they gave birth.
Maybe let me make this personal. If you had a partner, you yourself, and they gave you HIV, wouldn't you feel like killing them?
I cannot say that
you wouldn't kill them, but you would feel like, okay, this person has really
betrayed, because I have worked so hard to protect myself from getting HIV. So yes, I would feel sad.
What's the best
since I have never encountered it, I don't know if I would kill the person.
Because what's the best way to handle such a situation? Just from maybe a medical point of view, any advice you'd give somebody who has been betrayed to that level? Because they can do anything.
I do think that, in all honesty, psychologically, I don't think that the person is more angry at their partner. I do think that the person is more angry at themselves for putting themselves in that situation. Because maybe you could have tested your partner and yourself before having sex. Maybe I could have done this. Maybe I would have done that. So you blame yourself more than you blame the person that gave you that the infection. So I think that the best way forward is to forgive yourself and tell yourself that I am only human. How do I move forward from this? How do I seek therapy for this? How do I seek counseling? Where can I seek help? How do I help myself to fight off the infection, so that I can, if you already have children, so that I can be around for my children, so that if you're pregnant, so that I can protect my child? Because then, like, it will be more heartbreaking for you to wallow in the pain and the anguish than for you to look forward to that child and protecting that child. So I think the best way forward is to forgive yourself, to look for counseling services, to look for therapy, to join people that are there for you, so that you can overcome that betrayal.
Okay, and how best would you advise somebody to break the news to their partner that they are infected with HIV? First of all, that's even tricky, because I don't know how you can bring yourself to do. Some people fall in love and then they keep it a secret, like you've said, for a very long time. But what is the best way to break the news to somebody and say, you know what, I actually am infected? One, you risk, definitely 90% of the people will not stay with you. They'll vamosh immediately. So what would be your best advice towards that?
My best advice towards breaking the news would be to go with your partner to the HIV counseling unit or the HIV testing center, and they will counsel you both at the same time, because your partner also needs to know that they are safe or that they don't have the HIV yet. So it is more advisable most times when during testing, when they find out that you have HIV, of course they will advise you to invite your partner too, so that the both of you come back together. so that your partner gets tested. So I do think that it would be more comfortable for you to talk up, to break that news to your partner in a safe environment where there is a counselor and there is someone to mitigate whatever might happen afterwards. So yes, I do think that it would be easier for you to break that news in a more protected environment where in case anything is about to break down or to happen, there is someone whom, might I say, you would respect more and comport yourself. So yes, I do think it would be better to break the news in an environment like that.
Okay.
And then also because it will allow your partner to be tested and to be cancelled, and the both of you can find a way forward. If it is not forward, then you both move your own ways,
but amicably.
Yes, in a more composed environment.
Thank you. Meaning there's a risk of things getting violent.
Yes,
and people
because
getting
it
physical.
is bad news.
Very bad news.
So, and most times when people receive bad news, we react differently. Some people might just freeze, like they don't know what to do with the news, and then some people just become aggressive. So you don't know what kind of person your partner is.
True.
So it would be better to do it in a safe environment.
Talking about that, maybe caution people to prevent themselves and give them some. We know the ABCs of prevention, but maybe like shed a light on prevention so that they go away knowing how to prevent themselves, so that they do not have to get to that level of breaking up to their partner in case they are still negative. How do they keep negative as we come to the close?
Oh, so if you're in a relationship, you're married or you're having a fiance or you're dating, it would be better for you to stick to that one partner, especially if you've already tested yourselves and you're both negative.
Yes.
It would be better for you to remain faithful to your partner, and also throughout that you can also still use protected sex, especially if you're just girlfriend boyfriend phase. It would be better for you to engage in protected sex. Use a condom, please.
Because things
And
might
also
end.
you might abstain, like Christianity teaches you, abstain until you're married. So you test yourselves, you know that your partner is not HIV positive, you remain faithful, you abstain until you get married, and then you can start indulging after getting married. But also test yourself. In case you were proposed to like a year ago and you guys have been, you're thinking that, oh, I'm faithful to my fiance, but then your fiance is moving around. So it would be nice that even if you tested yourselves right before your marriage or your wedding ceremony, you retest again before you go into your honeymoon.
Very true. Okay, and maybe last but not least, there's this thing about pregnant mothers where they encourage them to walk around, not to sit all day, and to be active. But if they have the disease, the HIV and AIDS infection, do they actually have to also go about their work normally, or are they exempted and advised to maybe sit at home and rest since they are already sick?
No, having HIV does not prevent you from exercising. You have to be healthy for your body to be able to fight disease. So you do have to exercise, you have to walk around, because pregnancy comes with also other risk factors. The reason they're telling you to move is because pregnancy is a hyperdynamic state. You're producing a lot of platelets. When you don't move, you'll end up having clots, which is also not healthy for you. So it is advisable, like people living with HIV can live like other normal people. You can exercise, you can eat healthy, seek medical advice. In case of bleeding during the pregnancy, you'll also be advised equally, because even ART units or HIV treatment centers also have days for pregnant women and conditions. Certain times when you're going through certain pregnancy challenges, you will be referred to a higher person or like an obstetrician to help you out, to help you know how to move about with whatever you're going through, because also like bleeding might increase the chances of transmitting the infection to your child. But different people are different, like they present differently, they are going through different challenges. So depending on what you're going through, you can seek advice for whatever you're going through. But it ideally, being HIV positive does not prevent you from doing other things.
Okay, that is very beautiful. Any last words as we wrap up the show today?
Yes, it is very important for you to take your treatment if you have HIV, because most times when you have undetectable levels of the virus, it means you cannot transfer the infection to your loved ones, whether it be it children or be it your partner. So you can move on with your lives amicably or live a good life. There are partners of people who have HIV, but because their virus level is undetected, their partners are very healthy, their children are healthy, and they're living healthy lives.
Okay. Thank you very much for being a part of Issues at Hand. Please do come again if we invite you to give such information to our viewers. You're most welcome. Now, of course, we do remember that among other voices that are trying to end AIDS by 2030 is the Interreligious Council of Uganda, that is emphasizing abstinence from sex and calling on parents to engage their children and boost parental guidance that will guide them in navigating social relationships, among other strategies. We also remember the Vice President, retired Major General Jessica Alupo, asking the country to cooperate with the initiatives that government has put in place to meet the goal of ending AIDS by 2030. Otherwise, it is a very good morning. Thank you so much for being a part of Issues at Hand. I'd like to thank the production crew, all the way from transmission to camera team to the producers, and lastly the executive producers. My name is Karen Wamani. Until next week, it is a good morning. Have a blessed
Issues at Hand